Can you guys just first, as a general thing, discuss your findings from the EpiTRAQ study and the repeated validation tests that it took to demonstrate the validity of the EpiTRAQ?
I would say, as like a co-principal investigator along with Dr. Joshi, kind of the really high level view from the sort of the tool is that, we wanted to understand, what the readiness was of, youth and young adults as they were moving from these two, sort of worlds between, pediatric sort of model of care to adult model of care in the realm of epilepsy. And so, in creating the tool and wanting to validate it as a reliable measurement of that readiness, we basically wanted to see, is this something that's practically, sort of given in the clinic? Is it something that youth and young adults can fill out in a reasonable amount of time? How well does it actually capture some of those individual metrics of what we think are important for not just youth and young adults with epilepsy, but just the general experience of taking care of yourself as you become more independent and work into that adult model. So I mean, the overall summary is that we found that it was a valid tool, that it's something that's found over time, like when you compare even for some small groups of individuals who filled it out more than once, that we found that often the scores would increase a little bit, which you would expect to occur over time. We hope that someone, as they transition and eventually transfer, becomes more ready, to take care of themselves independently in that context. So that's just one little snapshot, but as a tool, as something that you can measure, as something that you can apply hopefully broadly in a diverse population of individuals with epilepsy in that age range. This is something that seems really exciting.
So how can this tool help with identifying a patient's preparedness regarding seizure control, whether other things such as SUDEP risk, things like social isolation? How does the tool help in those sorts of aspects?
One of the things that this tool does is, first of all, it's a very simple tool to administer and for people to fill out. It does not take anybody more than really a few minutes to fill out. Maybe the first time they fill it out, it's maybe 10 minutes. So while they're even, if they do this at home before coming into a doctor's office, or they do it while they're waiting in a doctor's office, it's easy to do. And what can be done is you can look at where specifically is somebody not doing well, design intervention measures around areas where somebody is not doing well, like they don't know their medications, even though we've gone over their medications so many times. So you can design an intervention around taking medications, talking about rescue medications, talking about folic acid supplementation in women, talking about a lot of things that are on there, and then using that as a tool to build. There can be a lot of positive reinforcement that a tool like this can give over time when scores improve, and I think it builds self-confidence. It also builds, it also makes an adolescent feel really good about themselves as they get older and start managing all this. I think one of the things, there is not a specific domain looking at risk factors for SUDEP specifically. However, some of the things that we know for SUDEP is epilepsy that's better managed probably brings the risk of SUDEP down. And I think one of the, even though it might not be stated in black and white, but I think one of the overarching goals of a questionnaire like this is to improve transition readiness, which means to manage their epilepsy better also.
Yeah, I agree completely with what Sucheta said so far. I think, obviously some of the bigger questions that this study certainly doesn't answer, but starts to maybe allow us a framework to understanding better in the future with more research, I think, is, if you could understand whether or not someone is prepared for transition, does a person who's prepared for transition have a better outcome, and is that outcome relative to the risk of, breakthrough seizures? Is it related to, social isolation or success in areas other than just seizure control? Is it an outcome related to, mortality, from SUDEP? I mean, these are all excellent questions, things that I think that this tool maybe would start to help, give us a way to compare, whether or not transition readiness is related in any way to any of those outcomes, something that we don't know yet.